Good afternoon. I am Dr. Lata Bhat, a developmental pediatrician in Delhi. Developmental pediatricians, we take care of developmental disorders of children like autism, hyperactivity, ADHD, learning disability, and physical disability. Today I will be talking of autism. Autism is a spectrum disorder. That means there are wide ranges of presentations. So it's known as autistic spectrum disorder. Why I chose to talk about it is that incidence is alarmingly high. It's about 1 in 68 children, which means it's a sort of an epidemic, and if not addressed, can lead to disaster. The cause is genetic, and if one child has autism, the risk of autism in future siblings increases tenfold. So what is autistic spectrum disorder? It affects the communication skills of a child. It affects speech, language, as well as the non-verbal communication. Communication is exchange of thoughts, ideas and feelings between two or more people in a meaningful, interactive and purposeful manner. So that is affected. Speech is delayed and deviant. Now, how does a parent or a caretaker suspect the child is at risk for autism? You have to closely observe the child. Initially, the non-verbal communication comes first, and then the speech comes later on. A child communicates with the caretaker with social smile by 1.5 to 3 months of age. Then starts vocalizing, then starts babbling by 6 months. Waves by 9 to 10 months. Says meaningful words like mama, papa by 10 months to 1 year. So below 1 year, you closely observe and you feel that child is not communicating to you in a verbal or non-verbal fashion. You have to approach your pediatrician and should be assessed by a developmental pediatrician. Eye contact should be meaningful, purposeful and interactive. Later on, the speech is delayed, much delayed. There can be echolalia, that means they repeat the same words. They can be neologisms, that is nonsense words. They can be normal children have something called joint attention. That means if a caretaker is pointing at something, they look at that and later on disengage when the mother stops pointing. So there is no joint attention in kids with autism. There is no finger pointing. They can have repetitive behaviors. They can have restricted interests. So repetitive, restricted behavior along with non-verbal and verbal communication skill disorder is autism. Sequential assessment of normal development is very important by a pediatrician, or preferably by a developmental pediatrician if there is any problem at any stage. And age at which you notice is very important because when the child is very young, it is receptive speech. Before the child develops or reaches the age when she is speaking. Say at 1.5 years, it's too early for expressive speech. Receptive speech is there. At 1 year, child should follow one action command. Go there, come here. At 1.5 years, child should follow 2 action commands. Go there and sit down. At 2 years, child should follow 3 action commands. Go, pick up the mobile and get up. There should be meaningful gestures. The child should understand mother's gestures. So a risk for autism should be detected early and intervention should be started early because in the first 2 years, the brain has fantastic capacity to develop. So if the therapies are started early, especially for 2 years of age, the results are very good, as early as possible. And once you suspect, approach a developmental pediatrician who will do the detailed assessment and guide you further. So this was part 1 of autism. I'll be talking about part 2 and further about how to assess and what kind of treatments are available in my part 2. For any further queries, contact me through Librate or at my clinic, Palak Child Development Center, shop number 106, Purvanchal Plaza, Mayur Vihar, Phase 2.